back to the Third Wave podcast. I'm your host, Paul Austin, and really excited about this episode today. I was able to do this in person with Ingmar Gorman, who is a clinical psychologist, I should say Dr. Ingmar Gorman, a clinical psychologist and principal investigator in MAPS's research into MDMA-assisted psychotherapy. You know, the reason that we organized this conversation was about 6 months ago, around the Horizons conference in New York. Ingmar and I sat down and had a discussion about microdosing. And a few months ago, he published a piece on Chacruna, who is run by Bielabate, about the controversy surrounding microdosing. So I wanted to set up this podcast so that we could kind of go back and forth about our understandings of the microdosing phenomena and what was legitimate and what maybe there are reasons to be skeptical of. And so that's really what we dug into in this episode, is the rise of microdosing and why Ingmar believes that we should be cautious about its benefits. We recorded this in his office space at the Center for Optimal Living, so it was great to meet in person and do this, and I really do think that you all will enjoy this podcast. Hey listeners, just a quick interruption, a quick add-in before the start of the podcast. We're now offering a special discount code for any podcast listeners who want to access our microdosing course. The discount code is Third Wave Podcast, all lowercases, no spaces. Third Wave Podcast, all lowercases, no spaces, and that will get you 15% off the Third Wave's microdosing course. This is a special little thing for only our podcast listeners. Again, Third Wave Podcast, all lowercase, no spaces, for 15% off our microdosing course. So without further ado, I bring you Dr. Ingmar Gorman. Yeah, let's just go ahead and let's jump in, and just some background for the listeners who are turning in. I'm sitting across from is it Dr.
Yes.
Ingmar Gorman?
Yes, it is.
Dr. Ingmar Gorman. You just recently finished your PhD.
That's
then, right?
Yeah, summer of 2017. Yeah.
Cool, and let's talk a little bit then about the process of how you got involved in. I mean, we can generally start with psychedelics, or if you just want to orient towards psychedelic therapy. I know you're leading the phase 3 trials for MAPS here in New York, so I'd love to just get a little into your story.
Sure. I mean, I'll be happy to share a little bit of my backstory. So one place to maybe start would be Prague, the Czech Republic, in the early mid-2000s. I was living there, and there was a wonderful expatriate scene. I'm half Czech. I was partly raised in the Czech Republic, and I had just dropped out of college, out of the University of Chicago, and I was figuring myself out in a way. And I bumped into this really cool expatriate scene, and Americans, people from all over the world, but also a good number of people from the U.S. living in Prague. This was, the Bush era, second Bush era of politics. So there are people who are very politically minded, and I became more aware of the role of psychedelics, particularly LSD, in what is the former Czechoslovakia. So as some of our listeners may know, Stan Grof is from Prague, and but there were also many other people who stayed in the Czech Republic. They didn't have the opportunity to leave the country during communism. And there was this rich history of psychedelic therapy, psychedelic research that took place from, it really goes before even the 40s, because there was a lot of work with interest in mescaline. But that history was there, and so it was this really neat kind of lining up of learning about that history and also hearing from these new expatriate friends that I had made there who were interested in sort of psychedelics, and from both like a kind of cultural perspective as well as a therapeutic perspective. And I thought, well, you know what? If I'm going to go back to school and dedicate my life or career to something, it would be very cool to dedicate it to something like psychedelic psychotherapy or psychedelic research. It represented to me something that was an underdog in a sense, something that seemed to be really unlikely But if there really was some validity to the potential for these substances to be transformative and healing, then it'll be, wow, what a great opportunity to look into something that has been overlooked due to the restrictions around the research. The other aspect of this was that, having grown up on a more personal note, having been raised both in the Czech Republic and the U.S., I felt that I always occupied these two different worlds, and was sort of I existed between these two very different cultures. I mean, the pinnacle of capitalism in the U.S., and then literally 2 years after the fall of communism. So Czech Republic, Prague in the early 90s was technically transitioning into a capitalistic society, but it had, and still to some degree still has, certain it's not your typical capitalistic culture.
Sure.
It inherited some things from their experience of being under Nazi control and then communist control. And so, of course, I was very young at that age, but throughout my life, going back and forth between these two countries, there was something about psychedelics and what people had spoken about psychedelics and about psychedelic experiences that really connected with me on a personal level, with this idea of living between two worlds and seeing how the world can be different in different ways. Sort of, if we think about psychedelics as something that sometimes helps people call into question their fundamental beliefs, the way that they live and operate in the world. If you move to a different country, and I don't mean visit Europe for 2 weeks, but really live in a different place, and you begin to really pick up on how people are different, that to me is a psychedelic experience. You begin to question certain fundamental beliefs that you thought were true. I mean, maybe to bring it up till today, I was looking to have a career and study something that I actually really cared about and was passionate about. And in this case, it was the potential for psychedelics to help people, to pursue that question. And so, I went to college. I went to the New College of Florida, which is where Rick Doblin went, and a lot of people who are now kind of actively involved in this world came from that school. And then I went to the New School for Social Research here in New York City to get a clinical degree, a PhD. And so really from the year 2005-ish to today, my fiance, she reminded me of this. Sometimes I forget. She's like, you've pretty much single-mindedly pursued this goal for 13 years or so. And so today, I do many different things, but one of them is as the co-principal investigator or co-clinical investigator of a phase 2, phase 3 study, 2 studies of MDMA-assisted psychotherapy for post-traumatic stress disorder. And that's one site here in New York City. There will be another site in New York that's at NYU. And I'm running what we call the private practice site. So it's independent of an institution. But both sites, the NYU and ours, will be or is sponsored by MAPS, the Multidisciplinary Association for Psychedelic Studies.
Right.
Yeah.
And one really interesting thing about this that I just want to dig a little bit deeper on is, as you said, you started to go to school in 2005, I believe?
That's when I went back to college, yeah.
Right. And so we know that, Roland Griffith's kind of groundbreaking paper on the relationship between psilocybin and mystical experience was published in 2006, I believe. So you pretty much been along this journey. When you made that commitment, you've seen how this has developed from a small sort of seed to what it is now. What I'd just be curious, just a few minutes about what's that experience been like for you and seeing that developmental process.
That's a fantastic question. Well, I can definitely remember the turning point, which was, for me, from my perspective, was I was at grad school here. It was pre Michael Pollan's article and post Michael Pollan's article in the New Yorker about psychedelics. Prior to that, I would go. So part of my training is to go on what are called externships, which are like miniature versions of internships, basically trying to get, or where we do get clinical hours, so we get exposure to psychotherapy. And in different states in the U.S., there are different processes. In New York City, since there's so many students and so many sites where a person could get that kind of clinical experience, it's super competitive. And so you go on these interviews and you're trying to be your best, and you're there with other people who are basically competing against you, other students, and often you can, you'll get a mix of interviewers who are either, they're trying to make you feel okay, but some of them are really trying to see if you're going to crack, under the pressure. And for me, a big piece of that was often like, okay, well, how much do I talk about my interest in psychedelic therapy or research, right? Because some people will have a really negative response to that, and some people will, anything from neutral to supportive. And I remember one year prior to the article coming out, talking about my interest, and the response would usually be something like, like that's weird, or never thought of that, And then after the article came out, it was people knew, they heard of MDMA-assisted psychotherapy for PTSD or the Psilocybin treatment. So that to me was like, okay, something changed. Right. Something really changed in the culture. And so that to me, there are other things I could maybe comment on, but that is what comes to mind. Yeah.
So this one article, which is the trip treatment, that was published, I think, in February 2015 in the New Yorker, so about 3 years ago. And it's interesting that you bring that up, because I was, about a year ago, I went to the Psilocybin retreat in Jamaica that I believe Catherine McLean is at right now in Treasure Beach. And I remember probably there were maybe 10 to 12 participants there. I don't remember the exact number. And more than half of them, the way that they had heard of psychedelics was because of that article. Wow. And it was just one single article in the New Yorker. And I think this kind of, again, speaks to then the present moment and bringing it back today, because Michael Pollan's new book is coming out in a little under 2 months. Yeah. And, I think that's going to continue to signify this tide shift from a cultural perspective and how our world is perceiving these substances.
Yeah, definitely. Something just popped into my mind. I think we're kind of going in a freewheeling way with this interview. And I think that maybe the best things come out maybe in a nonlinear way.
Absolutely.
So let's follow through with it. I had, it actually also relates to my history. In 2008, it was I always get confused. It was the World Psychedelic Conference in Basel, Switzerland. 2006 was LSD Symposium, but they were the same place. 2008, I presented a poster with a friend of mine, Petr Winkler, and we worked together. It was a kind of qualitative, semi-quantitative study looking at mental health professionals who worked with psychedelics, particularly LSD, under the former Czechoslovakia under communism. Mm-hmm. So we spoke to these people, and I could talk a little bit about that. But that study was made possible in part to a journalist named Ross Crockford, who's from Canada. Mm-hmm. This is all going to come back together. But the reason why I mention him is because I saw him in Prague a year ago or two, and we were talking about the media coverage of what some people have, dubbed the Psychedelic Renaissance. Mm-hmm. And he said something that was very poignant and still sticks with me today, which was that right now we are in, what did he say? Not the limelight, but we're in sort of the good graces of the media. Right. And that wasn't the case. Could definitely think back to 20, 30, 40 years ago. Mm-hmm. And he was sort of warning, that can shift. Because we know very well from the news coverage today, if you turn on any channel, or the clickbait, right, that it's attention that media the industry sort of wants from us. It doesn't necessarily matter what the content is, you know. And so there could be this possible future if, and I think a lot of researchers are afraid of something negative happening, and then that narrative of, you know, psychedelics, fill in the blank, something negative, make you go crazy or whatever, then returns, right? So we're kind of celebrating right now on the precipice of this book coming out, which I think is going to be I think it's going to be a positive thing. But I think we always have to be wary of like how things can change.
And I mean, have you like explored that possibility or that question at all, like either internally? So, for example, you know, Horizons, which I know you're on the board.
The board,
of.
yes, yeah.
You know, the first Horizons that I went to was the one in 2016, where Bob Jesse spoke. And he spoke specifically about this topic in terms of what could go wrong. And he listed out like a number of things that could go wrong with this, some of which I thought were legitimate. So one of them was like if something goes wrong in a clinical trial.
Yeah.
Like there haven't been really any issues, so to say, in any clinical trials yet. But even if it's completely unrelated to the psychedelic, so for example, someone has a heart attack or something, who knows?
Yeah.
Then could that be like tacked on to, you know, the experience itself? Or like what I can see developing, for example, now that we're talking about this and it came to mind, is, you know, like there was a pretty strong connection between someone like Charles Manson in the 60s and psychedelic use as well. So what if that narrative pops back up again about, you know,
brainwashing and
cults and that sort of stuff? So, I mean, have you given any thought to that in terms of what are possible scenarios?
I have a anxious neurotic predisposition. So I'm always imagining scenarios of how things could go wrong, but also I think that's also adaptive. What I'm trying to do is like be prepared for what may happen. But that being said, you know, and I've spoken to Rick Doblin on this topic a few times. He feels fairly secure, and I feel also pretty secure that in terms of the clinical work and the research, it would take a lot to, I don't know, actually I can't imagine what it would take for that to be derailed.
I mean, the only thing that I can think of is like the dissolution of the United States, for example. You know,
really
like
dramatic.
literally like something happens where like we enter like a post-nation state world, and then all these infrastructures that have been created, the FDA, whatever, they don't support that anymore. But I don't see that happening in the next like 3 years, you know, or in the next like 20 years.
Right. So it's like something, right. So the thing to be mindful of is that, you know, in any kind of clinical trial, there are side effects, or there are unpredictable effects, and there are what are called adverse events, right? And the FDA is prepared. You know, that data, that event is examined like any other, and so it's not like we do everything that we can. At least I can speak on behalf of the trial that I'm co-managing and co-directing. I mean, we have people go through a cardiologist, they go get an EKG, they, you know, depending on the results, they can even get sort of a nuclear stress test. So there's a lot of preparation and screening to make sure that a person will not have a really significant adverse event. And if something unpredictable happens, that can happen. And does happen in studies, and so you just can take that as to be part of research, part of clinical work. Outside of that, something like Manson, like cult, like I don't know. I guess these things are hard to predict and hard to imagine. I guess I'm hoping that our dialogue around substance use generally, I mean, this goes beyond psychedelic research, and really applies broadly to some of the other work that I do as a clinician, helping people with substance use disorders or substance misuse. I think we are becoming more nuanced in terms of our conversation around that, and that may be partly driven by rates of current opioid use, current conversations around trauma and how that manifests and how that leads to people going down certain routes in terms of their mental health. So I think I'm hoping that we've come to a place where we can have a more nuanced conversation and not go into hysterics about these kinds of things.
Well, I think, and this is where like something like cannabis is so interesting, right? Because, I refer to the work of Ken Tupper. Do you know Ken?
Yes, yeah.
Ken's a great guy. Had him on the podcast before. We're pretty good friends, and a lot of the work that he's done is talking about these normative state-sanctioned altered states that we have,
Right.
which have been integrated because of colonialism, tobacco from the New World, xanthionated beverages, coffee and tea from the New World, and also, elsewhere, and then alcohol, not beer and wine, but like gin. In particular. And so we have these three that have been built up because of industrialism, by and large. And so I think this is what then is so interesting that cannabis represents, is it's this, other substance that was previously illegal, that's now legal. And so now all of a sudden people are like, kind of like turn on their head. And then going along with that, like you said, we have the opiate crisis, which is all these things that have been prescribed legally.
Right.
And then we have also the pharmaceutical, I would say, crisis of sorts, where a lot of people are realizing that the typical pharmaceutical medications are not as effective as we had once thought or hoped.
Right.
Which of course ties back into psychedelics.
Right. And this is I get a little bit cautious in this territory, right? Because I'm not a psychiatrist, and I certainly don't want to. I want to preface this by saying that certainly not like anti-psychiatry or anti-psychopharmacology or anything like that. But somebody recently who I've been talking to, some people may know Ethan Goldwater. He was telling me about his observation that many people, particularly in their 20s, young people who are approaching psychedelics either through ayahuasca ceremony or however, maybe through microdosing, his observation is that they're feeling like the typical prescription medication that they had been on, often from a really young age, right? I mean, that's another...
Like Adderall, for example.
Right, is a really good observation that, like, yeah, we're now having people who are now who are becoming independent. They're in their 20s, early 30s. They can be making now decisions about their own mental health, and some of them are questioning the medication that they've been on, and they're turning to psychedelics or microdosing as an alternative. And I just want to be clear that I'm not condoning that. Like, I think there's a lot of risk involved there, but that doesn't mean we can't turn our backs to reality. Like, if that's happening, then we need to, as a clinician, I feel like I know I have to provide some sort of safety support around whatever decision a person decides to make.
Right.
I want to say one more thing before we continue, because it's not clear. Like, currently, this interview is happening at the Center for Optimal Living,
right,
which is where I direct the Psychedelic Education and Continuing Care program, where we basically do what I had just mentioned. So we don't provide any psychedelics to anybody, but what we do is work with individuals who come in who have what we say they have any kind of relationship to psychedelics. That means that they may have never even done psychedelics, but they've heard about it in the news. And what we do is we provide not just harm reduction in the sense of kind of identifying the risks and working with them in that sense, but also to kind of clarify what the clients or patients, what their goal is. Like, what are they looking for? How has it been working for them? Can that be fine-tuned? And that's sort of another aspect of who I am and what my work is. It's not just as a PI on a clinical trial, but also, and working with people who have a relationship with some sort of substance.
Right.
Yeah.
Right. Which kind of, I think, brings us to the crux of the conversation, which we really wanted to talk quite a lot today about, which is microdosing.
Yeah, that's right.
And I think, we had spoken at Horizons, 5 or 6 months ago about microdosing, and you just had mentioned to me that because of the rise of interest in microdosing, you've had a lot of people who have now come to the Center for Optimal Living, like, asking about it and whatnot.
Yeah.
So I just would be curious to hear, like, when did you first become exposed to microdosing? And then, what was that process in terms of your understanding of it and your hesitations or concerns about it?
So I heard about microdosing for the first time. I think I know that I was at the New School. I was a graduate student there. I was working with, a friend of mine, Russell, was, I'm blanking on his last name, but Russell was, he expressed interest in this question of microdosing, and he was collaborating to some degree with Jim Fadiman around the collection of experiences that Jim Fadiman was receiving from people about their microdosing experiences. So that was, I think, around that time was when it first kind of came on my radar. I think like most humans, I've had my opinion about microdosing, like any kind of thing, like shift over time. I think it's really important to acknowledge that, our opinions change, and that's a healthy thing. And I don't think I could even tell you when I thought what, but I can still access sort of the different reactions that I have to it, which is one is, that's like interesting, right?
Mm-hmm.
In the sense of, well, it's not like how I typically conceptualize psychedelic use to be like, either recreationally or clinically or otherwise. I think there's definitely a little bit of defensiveness to some degree, right? Because, it raises the question of what is the optimal way to use this substance? Mm-hmm. And again, that can be both in the question, in the realm of outside of clinical research or clinical work, and then and also within, right? And so there's a reaction to that, and I think that reaction comes in part from this idea that somebody is using a psychedelic on multiple occasions. If you're following the protocol, is it every 3 or 4
2 times per week?
Two times per week and it's like what, like 4 months or something like that.
Like I did it for 7 months initially. Jim, I think, recommends 5 weeks. Mm-hmm. But even then, you had someone like Paul Stamets, mm-hmm. who was on the Joe Rogan podcast in the past couple of months and mentioned 5 times a week, mm-hmm. which then you're taking it from. I think a lot of the conversation around microdosing has still been as a quote-unquote drug, mm-hmm.
meaning
that although the effects might be sub-perceptible from a mm-hmm. visual perspective, mm-hmm. You might notice a slightly enhanced sense of touch or feel, which kind of gets into another thing about microdosing, the definition. And the way that Paul spoke about it was more as like a supplement. Mm-hmm. In other words, you're taking this like fish oil or something on an ongoing basis, because it might have a potential impact. But yeah, so it's
well, see, that's like that I have a certain response to that, because it's like, well, what are we talking? Can we agree on what we're talking about? Mm-hmm. And not that that's a bad thing, but like if we're talking about something, we should know what we're talking about, because people use it. Sounds like people use it in different ways. Yes. People disagree about what sub-perceptual means. People disagree about dosing, and that could potentially have, maybe that's a significant thing, right? Those differences maybe are important. So another aspect of it that I have a thought about is, you had mentioned people coming into the center of the psychedelic program asking about microdosing. The thing that's different is that there have been people who have absolutely no experience with psychedelics at all, not just never having taken them, but never really even, not being really familiar with what they are. Right? So you read something that's in more of an accessible media piece in the newspaper, and psychedelics, microdosing helps with attention or creativity, and people come in with, say, they think they have ADD or anxiety, depression, and they may do, right? And so what's microdosing, right? And that's, oh man, like that's from like A to Z, right? That's a big leap from somebody who's had, say, an experience with a psychedelic, and kind of having a conversation with them around microdosing.
Right.
And like, who are we attracting to this topic, right? Not that there would be anything wrong with them, but we're this is a shift in who is approaching us, right?
Sure, and I think this ties in both to the conversation that we were having about Michael Pollan earlier,
Right.
in terms of a tide shift, and we've started to see the beginnings of this with microdosing because it has been covered by pretty much every major media publication you can think of, not only because of Jim Fadiman's work, but also specifically because of Isla Waldman, who published the book that was published by Knopf, and so then she got all this media for it, and
Yeah. And she's mentioned often when people see, just a sidebar, when people come here, I hear her name in her book a lot.
Yeah, exactly. And so I think that, but then that also speaks to, I guess, the reason why I'm so interested in microdosing is the same reason why I'm so interested in the work that Michael Pollan is doing with his book publishing is, from my perspective, it's two things. One, we've had the research on psychedelics since the 50s and 60s. And while the research that was done then wasn't necessarily up to today's standards, quote unquote, it was still research at that time. And it still showed that obviously psychedelics were useful. And then, of course, we've had all this research that has been developing, which has been phenomenal over the past 12 to 15 to 20 years. Yet still in our culture, there's a complete lack of psychedelic literacy. In other words, no one really is educated about this topic.
Right.
Outside of the very small subculture of people who maybe have had experiences with them before. So, I get excited at that notion that you're having all these people who have never yet, been exposed to psychedelics. The first time they hear about it is through microdosing. And to me, that represents a healthy shift because now they're approaching professionals who can then provide them with educational information so that they can make a decision about what they're doing.
Right. Yeah, absolutely. So, I definitely agree with that. The idea of education and access to information, I think that's extremely valuable, right? And that it needs to be available for people to make right decisions for themselves. I guess I come from my perspective is one of caution because being a mental health professional, I have encountered people whose I want to say mental stability. That sounds really derogatory, but like people who it is what it is. Some people have a very difficult time kind of just functioning in the world, right? To people who are like super highly functional, right? I've seen everybody from the severely mentally ill to very, very professional people, highly performing individuals, right? And the feeling of caution comes from, well, we don't have the science, the research, but I don't think this is for everybody. Right? I really don't think it's for everybody. And that's when, my role and where we're educating, I think we need to be careful about how we go about educating people. Like, that doesn't mean that we should be withholding information from anybody. I don't think that's useful. But I think we need to be also clear about, okay, well, what are the risks? What are the potential harms? Like, is this something that is for everybody?
Right.
So the point, like, that a psychedelic experience can be like 10 years of therapy.
Sure.
We've all heard that quite a bit.
Right. I just recently heard it from Gabor Mate on the Tim Ferriss podcast, which is why I was like, okay, this is recent and this is the
and our director of the center, Andrew Tatarski, is going to be doing a talk with Gabor in the end of May. For anybody who's interested here in New York to check it out. It's going to focus on largely about substance abuse or addiction. We tend to not use the word addiction here because that's a whole other conversation, but that we have, I think, issues with that word, but essentially it's going to be, I think, a little bit less about psychedelics and more about that topic. But that phrase, right? So the phrase 10 years of psychotherapy in one night, I think that creates a certain kind of expectation in people. And I don't want to say that phrase is completely invalid, but I don't know if it's also, I don't think it's 100% valid. what so I'm like qualifying this a lot, but what I think it does is for some people and this is one thing I think a lot about in the work that I do at the Psychedelic Education Continuing Care Program. What are people's expectations when they approach, and this could apply to microdosing as well, you know, that experience? What are they hoping for? What change do they think is going to happen? And then how does that change then come about, right? The thing is that even in the clinical trials with MDMA and the therapy that comes with it, people then have to do a lot of work. Like what I like to say is that, and I may have said this before, but that maybe psychedelics and MDMA, maybe what they do when combined with therapy, maybe they make change easier. Maybe it's easier to change, but you still have to change. You still have to do the work. Microdosing, I don't know. That exists in sort of an interesting middle ground, right? Presumably, I mean, you would know more than me here, right? So, and I wrote that Chacruna article, and maybe we'll talk a little bit about that. But one of the kind of things I wanted people to think about was what is not just your intention, but like what is your expectation? Like, is this something where you engage in microdosing and then what's the mechanism of change? Like, is it that for example, are your symptoms just sort of relieved while you're taking it as like a supplement, right? Or is it that then it's more than just a supplement? It's a way to engage with your present moment more or differently. So then you could have certain observations about how you function in the world, and then say, I think I need to change that about my life. And then you can do that without the microdosing, right? Or what? Like, you know.
But this brings up a really interesting relationship that Imperial College just published a paper on, which is this relationship between 5-HT1A activists, or agonists, whatever, which is largely like antidepressants, which is a passive coping model. In other words, when you take an antidepressant, it blunts you to dealing with stimuli in the external world. Whereas the 5-HT2A activists, or whatever, the ones that activate that receptor, they deal with active coping, which is what, kind of getting back into your question about microdosing, right? So are we utilizing that in a way then where it makes us better able to actively cope with our external circumstances, so that it's not just something that we're taking, for example, to cover up the symptoms, but it's actually something that we're doing on a consistent basis to provide maybe a little bit of fuel to integrate new habits and new ways of being.
Right.
And so that kind of made me think of that relationship then in terms of, you know, what are people getting out of this? Because I think one of the downsides, and I think let's do this. Like, let's outline that article that you wrote in Chacruna,
okay?
Because I don't want to put any words in your mouth in terms of what you did and didn't include. So it'd be great just to briefly go through that in terms of what were some of those hesitations that you presented, and then we can just provide a backlink so people can get more.
Yeah.
And then dig in a little bit more from there.
I was inspired by something that James Kent mentioned in one of his podcasts. Which of course Brian had recommended to me, so he turned me on to that, which was this idea of psychedelic legitimacy, which I think is a whole podcast topic unto itself, which I think is totally awesome. But the idea is, right, could you apply that to microdosing, right? That was the thing that I was playing around with, right? What would be the legitimacy of microdosing? What are the assumptions that underlie microdosing?
Can you just define psychedelic legitimacy just so people have a context for that?
Well, we are in our current world, society, we have to talk about whether psychedelics or psychedelic experiences or maybe psychedelic use is legitimate. And I'm using that really in the broadest sense. This in some cultures, in some countries, this is not even like a discussion. It's just sort of taken as a given that that's somehow integrated into their culture. So primarily because psychedelics are illegal, when whoever says that they are using psychedelics, they have to somehow legitimize that, right? And that can be gained through, these are the different categories, right? There is sort of the psychiatric medical model. we're investigating these things as potential medicines. Therefore, that's how they are going to get legitimacy, and that's potentially then how they could be integrated into the culture or society. There's the cognitive libertarian kind of perspective, which is I have the right to do whatever I want with my consciousness, and so why shouldn't I be able to do this? There is the historical model, which is saying, well, Kikeon or Soma or whatever sort of ancient rite or psychoactive compound was used so long ago, therefore it's right for us to do it now. It's sort of a little bit of a leap, but it's a way of giving legitimacy to these substances. And there are others. I'm blanking on them right now. Well, there was the one that James Kent presented was just the recreational. Like what's wrong with engaging in some sort of celebratory. It actually made me look up the etymology of recreation, right? Which is to recreate, to renew, right? So like a process of renewal, right? You can think about. I think that's kind of profound, right? So that's the legitimacy, and so I began to think about microdosing and thinking about, well, how is that presented, right? It can help you with your symptoms. It can make you more efficient at work, which I thought was an interesting one, and because many people in the psychedelic community are critical of capitalism in its current form, or just capitalism generally, and so I think people have taken issue with this idea of using psychedelics to become more proficient at work. But the funny thing is, there was an article not so long ago about psychotherapy. Are psychotherapists making people more? Is the psychotherapy process in capitalism just about making people more okay with how they're being exploited?
Yeah, and this is also like a criticism of some of MAP's work, which I've heard before, from certain individuals, where basically like, is MDMA for PTSD therapy just a way to make better like warmongers who will just send them back into war after?
Right. More efficient soldiers that can then right. Now, of course, I don't think that's true, but there are, you can raise that question, right? And so that's where that, and then of course my harm reduction psychotherapy work perspective comes into play, which is like, okay, as you as an individual, what are you, if you're interested in microdosing, what's the motivation there? What are you expecting to come out of it? And you've spoken, I'm going to wrap this around to something that you had said, which is that, about you speak of the potential for microdosing to be a way to not numb or suppress symptoms, but a way to kind of positively, actively engage with sort of issues or what's coming up for a person. Right. And I really think you have to contextualize that into who you're talking about, right? So people present with different diagnoses, and of course those aren't perfect, and there's all sorts of problems with categories, but for somebody who's depressed, for whom that activation may be useful, for somebody who maybe is, and I'm just kind of guessing here, but somebody who maybe has a psychotic disorder, maybe the way that their brain functions, they have a difficulty. Well, this is true. They have a difficulty filtering out information, right? Just already, right? And so what happens if potentially somebody's microdosing, and then they even have a harder time to filter out, because maybe that's one of the mechanisms in psychedelics and microdosing, right? Maybe that's not right for that person. So we have to be really careful about how we talk about things, because for somebody who this is contraindicated for could hear this and be like, oh my gosh, I've been taking all these antipsychotics, they make me feel blunted and terrible, which they sometimes do, right? And then they would, I guess my fear or caution would be able to think, well, this is a great alternative, and then it kind of leads to a negative outcome, right? it's really important, basically, like whose brain are we talking about? Also, in what cultural with what kind of psychology are we talking about, and what kind of cultural context are we talking about, right? I mean, is it in a country where they're going to be, put into jail for life, right, if they are found to have a psychedelic on them?
Right. I mean, this is one of the challenges in terms of when you do take a larger vision picture, which is more what our focus and my focus has been on. It is more at the larger thing. You lose out on some of the nuance that, for example, you might take from a clinical perspective because these are pertinent questions that you deal with on a day-to-day basis.
Right.
And so, I mean, this is one of the most fruitful things from the conversation that we had in October, I believe, was what are ways that you can hedge that risk, even in just from an educational perspective, when publicly speaking about these topics. Because while I am more oriented towards what's the upside of these, and I think part of that is just it's a counter reaction to the larger narrative, which is it's so bad, and so it's almost like, well, how do we balance this out?
Right. Well, it's also like the perspective of caution. And this is not just me. I'm really talking about. I think more broadly amongst researchers is, the fear of returning to the past where these substances were banned from being studied, right? It's two pieces. One, as scientists, we are, you may listen to this podcast and think that I'm very enthusiastic, and I am enthusiastic about this research, but I always hold out the possibility that this may not work. That psychedelics may not be helpful. Psychedelic assisted therapy may not be helpful because, ultimately, what am I doing? What I think we hope we're all doing is we're trying to make the world and people, like life, better for people, right? Sure. So why would we prescribe something that could harm somebody, right? So ultimately, that's what it comes down to. So, but at the same time, I think for some researchers there is this fear of we can't talk about the positives too much, because of the science piece of being unbiased, which I think is good. I think that's true. But also, if we talk about the benefits, then and something goes wrong, there's going to be this huge backlash, or we're not going to be legitimate scientists. And so I'm saying that because of your perspective, which is you've heard all the negative, so you're emphasizing the positive. There's a lot of people who are like working within the realm of the positive, and they don't want to overinflate it, or they want to also pay attention to the possible negative. You're both operating from these perspectives of revealing some sort of truth or getting at truth, right? But from two different angles. Which
I think is why it's so important to engage in conversations like this, because then
I agree.
With that process of engagement, then you find a middle ground that then
absolutely
works from a cultural and scientific.
Or at the very least, the people who are listening can kind of hear whatever side that they're approaching this from, they can hear the other side. And I mean, I'm also pushing this because I think we need to be doing this in areas outside of psychedelics. I think like globally, as a culture in the United States, we're not having enough conversations with people who we don't agree with.
Hello, listeners. Just a quick announcement and a few pieces of news before we get back to the interview. Albuquerque has voted to decriminalize marijuana possession following the example of other U.S. cities and highlighting the power of state and city autonomy when it comes to drug policy. The LSD 75 Festival in Basel, Switzerland will be marking 75 years since the discovery of LSD with talks from influential speakers and artistic workshops and events. This will be running from the 19th to the 22nd of April. And MAPS is inviting people to record a 2-minute long video explaining why LSD is important to you to celebrate the 75th anniversary of its discovery. If you're interested in doing this, we'll provide more details in the written up summary of this podcast on our website. Last but not least, we still have spots available in the Synthesis Retreat that is coming up in July and August. If you want to take psilocybin truffles in a legal, structured, responsible setting and do it with professionals, then reach out to us for more details on that program. That will be at the end of July and early August in Amsterdam. Thanks so much for all of your help and support. And now back to the interview.
So let's get back to the article.
sure.
So we were talking about psychedelic legitimacy. We were talking about
Motivations for use. We're talking
motivations
about
for use.
like kind of using it at work. I mean, I think that was one thing that we haven't touched on yet that I think is a concern to me a little bit, which is somebody who's totally psychedelic naive, who begins to maybe experiment with something that's very potent like LSD in an environment where, well, there are two pieces of it. One is, and I joke around with like being careful using heavy machinery, right? Like, you know, like don't be doing that kind of thing while you're under the influence potentially because of the potential effect of it being stronger than you anticipate. But the other one, which I don't know if this is entirely valid, I remember reading I don't know if it was Vice. It was one of those publications where somebody was talking, like they decided to microdose with a colleague and like kind of compare their experiences. People, I think, I wonder if people might have an adverse reaction that's more in the realm of like anxiety and trauma, you know, where they either have a past history of trauma or they begin to feel they're not familiar with the sort of psychedelic territory. They take a low dose. They're in an environment where they have to perform, and you know, hopefully it's kind of a work environment that's flexible where a person can go home or whatever. But what if that person has to really do something stressful? You know, that's not a good setting. You know, so I don't know. What do you?
Well, I think so. The approach that I like to take about this is this, for me, like when you're looking at doing it within a work environment. And like speaking from personal experience, I've never worked in a corporate workspace.
Right.
Whenever I've microdosed, it's been at cafes, it's been in my apartment, it's been in places that I am very familiar with, that I've been to lots of times, because I've never worked in any sort of corporate workspace. So a big part then of, from an educational perspective, what we say about microdosing, and I think this is the important part then about like some of the risks that people take on when microdosing is again, from my perspective, most of those can be mitigated with some basic common sense, which is one, you know, the first time you microdose, like don't do it in a public space. Like you should not be putting yourself in any sort of vulnerable situation the first day or probably even the first few days that you microdose. When I started microdosing, I did it after many years of regular psychedelic use. So I started microdosing in mid-2015. I had my first psychedelic experience about 5 years before that and probably had done psychedelics maybe 20 to 30 times before that. So like I had a lot of experience and I could easily calibrate my dose level, meaning that I knew if I took this, I would have about this effect. If I took this amount, maybe a little bit more, it would be a bit blah, blah, blah. A lot of people who are coming to this don't have that. So I think that's one, is don't be in a vulnerable space. But I think two then, again, from a work perspective, it's like, microdosing for me, and this is sort of the larger narrative that I've been working to develop in, not in opposition, but because of some of the backlash against, well, are we just microdosing to meet the end purposes of capitalism, so to say? Are people just microdosing to be better, more productive workers? For me, the big step, ideally, that people can take when microdosing is, again, ideally, microdosing, because of its effects, I think also lends itself to a deeper sense of self-awareness and self-reflection, right? And so then there are two transitions people can go through. One is I've started microdosing and I've come to realize that I've always known I hated my job, but I never really had the courage to quit and really pursue what I wanted to. And potentially microdosing can facilitate that process. So I think that's option number one. I think number two then is, again, from my perspective, like I love what I do, like, and I think the work that we're doing is important, it's valuable, it's contributing to a future that's going to be healthier, more sustainable, et cetera, et cetera. And from my perspective, although this isn't true like on a wide scale, again, from the conversations that I have, from the trends that I pick up on, I notice that there are more and more people who are opting to pursue work that's meaningful and has purpose, where the end goal isn't financial wealth and stability, the end goal is purpose, meaning, experiential wealth, really doing something you love with the idea of, well, as long as I can, like make, I think the figure is like $70,000 a year or something like that, then I know that even if I go way above that, my quality of life won't improve that much. So I see, again, from my perspective, it seems like a lot of people who are microdosing are not doing it to find their corporate jobs more palpable.
Yeah.
It seems to be a lot of creative entrepreneurs, freelancers, who are already doing things that they love, and they're microdosing to facilitate.
Well, please don't take this as a criticism, but that may also be, maybe it is a criticism, but maybe that's also the people who you're speaking to. I mean, when we think about, this is going to be sort of a social critique, right? But it also comes from my own experience at my work here and speaking to people who, well, I'll leave it at that. I've known people who are struggling at their job and don't necessarily have such of an opportunity to move jobs, or, I mean, there's always that, you just have to take the risk. But the other piece of it is that, a lot of people don't make $70,000 a year, and as the, like, as you, with your own sort of interest in kind of reaching out to more people, I don't know, it's if you can work in a cafe, or you have the luxury to work in a certain kind of environment, I think that's great. But a lot of people don't, right? And they're working under different circumstances, and I guess we just have to be mindful of that. I just want to bring that up.
Yeah, no, and that's a really good point. Is for example, I sometimes don't think about that in terms of my lifestyle, or even the lifestyle of people who I know who are microdosing is not necessarily representative of everyone who is microdosing. And that's, I think, an important thing to keep in mind. And this, of course, gets into the larger social critique question of then what are we doing on an active basis to facilitate changes in our economic structure so that it is more equitable, and so that people do have a chance to pursue meaningful work, and that they're not just stuck in jobs that they prefer not to be in.
And this also comes back to the and this is for a conversation I think that we don't have enough time for, but just to put a little bookmark on it maybe, is the availability of psychedelic assisted psychotherapy or MDMA-assisted psychotherapy if it proceeds beyond the FDA and gets approved. How can that become affordable to people who need access to it? Right. It's a big question. So these questions of affordability, of income, economics, insurance, society, they're connected.
Right. So one other thing that I wanted to hit on as well was, maybe we already dug into this enough, but I kind of wanted to open it back up.
Sure, please.
Was this idea of psychedelic legitimacy in terms of microdosing being this completely new paradigm in terms of how people are approaching psychedelic use. So in other words, the underlying assumption that obviously since the 50s and 60s, since psychedelics have been reintroduced into Western culture, they've largely been used in high transformative doses. And so what does that say about microdosing when instead of it being this I think this paradigm shifting dose where you go from day 0 to day 1 and you blow the doors open and all of a sudden, you're higher on the openness scale and all this stuff. Microdosing is more like a health tonic, so to say. And the reason I mention that word is because, one thing that I found to be really interesting from this microdosing event that we did in Bushwick, around Horizons the same day, Hamilton Morris spoke on the panel, and he was first to speak, and he brought something up which I found to be really interesting, that a lot of the indigenous cultures that he spends time around or has spent time around, that in fact their exposure to psychedelics is most often not in higher doses but at a lower dose level, again as this sort of health tonic. And so that's also something I want to dig in with you a little bit in terms of what's your understanding of that relationship between this high dose paradigm shifting experience and microdosing, which, again, to tie into our conversation about work, seems to be this modality that just kind of concretes or continues to validate some of the assumptions that we already have.
I'm just going to riff off of that, which is that one thing that comes to my mind is, right, the distinction between psycholytic and psychedelic, right? And psychedelic being kind of the full dose, often connected to mystical experiences. Now we kind of talk about it, versus psycholytic, which was the use of lower doses of psychedelics, particularly LSD, to enhance really what was psychoanalysis or psychotherapy. The idea that maybe that exists a little bit more of like within the biographic domain, and then the psychedelic full dose mystical being in maybe this sort of transpersonal domain. And of course, what some people have observed anecdotally is that when somebody engages in a full dose experience, they kind of go through a biograph, like there's a trajectory where the effect of the psychedelic is still coming on, and maybe they're in more of sort of a biographic place. Then they have this experience, and then as they're coming down, they're maybe re-entering in a kind of biographic way. So maybe there's like a psycholytic and psychedelic therapy happening at the same time. And so you're talking about microdosing. Well, one thing is that we don't really have any studies of psycholytic therapy nowadays. So that's something that's...
Is the MAPS isn't psycholytic then? The MDMA-assisted
Well, it is in the sense
psychotherapy?
that well, because we're now talking... If you consider MDMA not a psychedelic, right?
Just want to clarify.
Yeah, that's a good clarification. Yeah, so certainly MDMA-assisted psychotherapy for PTSD is not pursuing a mystical experience as the one that's operative in the healing, and so it is very much biographic. There's a little bit of mix of both, but sometimes people have a spiritual experience. So if we put that aside for a moment, the work with, say, psilocybin, there's not a lot around a kind of lower dose. And again, it's not a microdose. It's not a subperceptual dose. So that's kind of, so why is that neglected? I think that's an interesting question. And then microdosing is I know that Beckley is looking for funding for a study looking at microdosing and creativity.
Mm-hmm.
So there are these studies that are coming about, but it's not the same place as the other research is. Other cultures, I did look into whether the Betwi tribe used ibogaine, and I think there was a reference that I saw somewhere.
Mm-hmm.
But I had trouble finding, and maybe this is not because it's not accurate or that Hamilton is not right. I would trust his firsthand experience because he's had a lot of them. But I had trouble finding like academic references, whatever that's worth. I mean, it's worth a lot, but it's it doesn't mean that it doesn't exist.
Sure.
And well, I don't know what from an armchair anthropology evolutionary perspective, right? If somebody had access to, if we think about people who had access to these plants, mm-hmm. it would make sense that they would start off small. And I mean, from a practical perspective, I mean, you can't really have your mind blown on a full dose psychedelic experience on a regular basis in, I would imagine, most cultures, whether it be ours or elsewhere, right? You need to kind of operate in the world with whatever you're doing, whether you be hunting or working at in a cubicle, right? And so it would make sense that a microdose, people would kind of go that route before.
Right. And I think that's what's then, for me, it's so interesting about now how, this is reemerging mm-hmm. as a practice, was because we just had that very, in the past, binary, black and white. It's either you take a psychedelic at a high dose level or you don't do any psychedelics at all. And I think this is why it's kind of entering from a controversial perspective, is because of things that we've hit on in this conversation already. Obviously, there's a distinct lack of clinical research.
Right.
There's a distinct lack of vernacular or terminology around it so that we can actually have an accurate understanding of what is a microdose.
Right.
And then there's just the fact that it's taking place within a late-stage capitalistic economy that might facilitate endgames that, many people in the psychedelic space fundamentally disagree with. But I'd just be curious, in a conclusion, when it comes to microdosing, in your ideal world, or even from a very much, April 2018 perspective, what would you like to see done in the larger conversation around microdosing so that it does gain more legitimacy within, particularly what I'm interested in is within the clinical, academic, and institutional setting?
No, I mean, I think we definitely need the clinical research. I mean, we need the science. And the other thing is also the question of the placebo effect, right? And that's not just a criticism of microdosing, it's a criticism that people make of the psychedelic and MDMA-assisted psychotherapy, right? Because you can't blind, right? People know if they've gotten the active dose or not. But I think it's even more so when you're calling something subperceptual, right? Then you really need to have like a controlled study. But yeah, like let's do it. Why not, right? I mean, it could be really profound. But then the other thing is you also have to think about, well, what's the design of the study? What is the protocol around taking the substance? And also the duration, like for how long, right? And then what is your hypothesis around how long the effect lasts? Are you saying that it's good? I mean, these are just questions. Are you going to say that it's forever or that it has a certain period that is beneficial after you stop the microdosing? There's no reason, well, it's hard to get funding. That's the reason why we can't.
That's the main reason. I mean, this is like I was speaking to a scientist at Imperial who was trying to submit a grant to do a microdosing study, but his main challenge was like, how do I pitch, the outline of the study, because if people come in more than 5 times to microdose, then the study just becomes prohibitively expensive, and I don't get the grant money.
Yes. Oh yeah, and also you're right. So you can't give them the substance because it's Schedule 1.
Exactly.
They can't go right. They can't take it on their own.
Exactly.
Yeah.
So this is like, and so this is what I keep coming back to is like the primary issue is even with the LSD microdosing for creativity and problem solving experiment that the Beckley Foundation is doing, it's just a single microdose. And what we're noticing is the impact of microdosing is not just the day that you take it, but it's day 0 to day 90 because of that eventual unraveling process. Right. So like, even, it's hard to wrap around how are we going to find and discover the efficacy of these things until we have like a more mature approach to personalized medicine potentially.
Well, here's another alternative, which is doing naturalistic studies, doing qualitative studies. Right. Of course, they're I think inappropriately looked down upon within certain circles of academia, but and I guess that's what Jim Fadiman in part was doing, right? He was trying to gather data from people's experiences, but now through your network and your experiences, I mean there must be many people. Of course, you can't do that double blind part, right? But you can at least.
And this is what we're starting to roll out, and I know I'm working with someone from Imperial, who's doing a survey-based study with placebo-controlled, to set it up for people to do at home. So there is that coming out. We're also we just got our first, at the third wave, our first IRB-approved research study that we're going to facilitate as well with our audience about microdosing, so that's exciting. But yeah, I mean, that is, I think, the primary challenge right now is how do we properly study this to understand the impacts.
And what you can do with that data is you can also then present it to, it can help with getting the grants, instead of sort of starting from scratch, you can say, well, look, we've gathered all this naturalistic qualitative data. Look at that. Does that give this any more merit? But the scheduling piece is also, good. Yeah.
Great. Well, I just want to thank you, Ingmar, for sitting down and chatting.
Thank you.
If people want to find out more about your work or either what you're doing here or elsewhere, what's the best place to do that?
Psychedelicprogram.com is how you can access our work, where we both provide psychotherapy around psychedelics. Again, we don't give the psychedelic substances, but we do everything around That, but we also do education. So we teach clinicians and the public about, we do workshops. Actually, we have a workshop coming up at the April 21st and 22nd at the New School. Psychedelics 101 and 102 for clinicians, but it's open to the public as well. So we do that. We feel very passionate about that because we want to sort of educate the mental health field around what it means when their clients are using, right? It's a multi-pronged kind of approach to change. And then, well, there really isn't any way to access the MDMA-assisted psychotherapy research. However, if individuals are interested in participating, they can email info@mdma.nyc. However, this is a treatment for post-traumatic stress disorder, and there is no kind of, that's what it's for. So that's one way to access that. Yeah.
Great. Well, thank you so much.
Yeah, thank you.